For the third year, Americans are heading into summer with COVID cases rising across the country. The daily average number of cases is just over 94,000. It hit over 100,000 this Memorial Day weekend. That's at least 5 times higher than this time last year. Health experts say the Omicron subvariant BA.2 is now accounting for more than half of new cases. Dr. Celine Gounder joins me now. She is the editor-at-large for public health at Kaiser Health News. She's also an infectious disease specialist and epidemiologist at Bellevue Hospital and New York University School of Medicine. Dr. Gounder, so good to actually have you here in person. Tell us, why are we seeing this rise in cases?
I think a lot of people were counting on this immunity wall from the original Omicron that hit back in the winter months. And the fact is that the new variant that we see circulating right now, this BA.2, you're not well protected if you had an original Omicron infection against BA.2. And the vaccines, frankly, they're still protecting most people pretty well against hospitalization and death, but certainly not infection.
I think it's so interesting how you discuss this vaccine wall, this infection wall. Explain to us a little bit more about that. How long do we have that protection? How much protection do we have?
So after either an infection or a vaccine dose, vaccine booster dose, you get about 3 to 4 months of an antibody spike. But then after that, you're relying on your memory immune response to kick in again after that 3 to 4 month window to protect you. So it does protect you against more severe disease, but it won't protect you necessarily against infection. And then the other challenge is that we're dealing with new variants. So a prior infection may not protect against one of these new variants.
So we've got new variants on the horizon. We have waning immunity, at least against infection. Mm-hmm. And now we also are seeing, obviously, the beginning of summertime, vacations, proms, graduations, weddings, all of those things. Are you concerned about another surge?
I am concerned. I'm concerned about what just happened over the long weekend. And it's going to take at least a few more days to see those infections and then another week or so before you see hospitalizations. We are concerned also because the last 2 years over the summer months, we've seen a surge in the southern states as their weather gets warmer and people go indoors.
Dr. Anthony Fauci said in an interview over this weekend that we are going to be dealing with this virus on a chronic basis. What's that going to mean for how we live our lives?
Well, this really remains to be seen. We probably are going to need to develop new types of vaccines, additional medications beyond what we have now, and make use of the other measures we have available to us. So in particular for the elderly, the immunocompromised, it's going to be a while before they can go safely mask-free.
So let's actually talk about masks, because the U.S. Justice Department has just asked a federal appeals court to overturn an earlier ruling in April that stopped the mask mandates, the government mask mandates on planes and buses. Do you think that those mask mandates should be enforced? Are you hoping that that is something that the government will again be able to do?
Well, and the importance of this appeal of that decision is that it allows the CDC to preserve that power. If there is another big surge, that they have the public health powers to implement, whether it's masking or other such controls. I don't think you're going to see those kinds of mandates reinstated over the summer or anytime soon. But it is important that we have that tool at our disposal, not just for COVID, but for future pandemics.
And remind us, how effective are masks and these other preventative measures if people are immunocompromised or are concerned hearing about these increased spikes or worried that their waning immunity puts them at risk?
High quality masks really do work. And when we say high quality masks, we're talking about N95 masks, KN95 masks. I worked in the hospital for almost a year before I got vaccinated and never got COVID because I was wearing a mask consistently. I was wearing it over my nose and mouth and, properly. And so these masks, if you use them correctly, really will protect you against infection.
Let me ask you a follow-up question about that, because especially in the summertime, people don't like the heat of some of the more protective, the KN95s, et cetera. Are cloth masks at all helpful? How much do they actually assist? And is it necessary if you're in a group of people outdoors to wear a mask?
If you're outdoors, that's essentially infinite ventilation. I don't wear a mask when I'm outdoors unless I'm, just coming out of someplace and popping back indoors. You do not need to wear a mask outdoors, but indoors, wearing that KN95, that N95 really is more effective than a cloth mask. If I had to ballpark it, your reduction in risk with a cloth mask might be something like 30%. With a KN95, maybe 50 to 70%, and with an N95, well, by definition, 95%.
That's really helpful to actually give people the information so that they can decide how they want to protect themselves. Before I let you go, though, I want to talk to you about monkeypox because the UK is now urging people who test positive for the virus to abstain from sex. The WHO has reported 550 cases in now 30 countries. This is not like what we've seen in the past, which is usually confined. How serious of a threat is this?
I don't think this is a threat in the way that COVID has been a threat over the last 2 years. It is not going to be deadly at a population level. You're not going to see 1 million deaths from monkeypox as we did from COVID. But we are seeing it actively spreading among communities of men who have sex with men. It is not necessarily a gay disease. It is a matter of time before it spills over into the rest of the population. But we really do need to have our eyes on this and make sure that we're testing people adequately, isolating them if they're infectious.
All right. Dr. Celine Gounder, thank you for joining me, and thank you for all that you do.